just now, if there's any question, go for it. But if not, you know, if afterwards you want to put a question in the chat, then do go ahead. Here we go. We've got Gillian Trimble. My GP doesn't agree with weight loss medication. They prefer diet and exercise. Do you have to inform them? Okay, that's a good question. So I find that's saddening to me that the GP doesn't agree with weight loss medication, because this medication, you know, we've seen the fantastic results that patients are having in terms of weight loss, and we know that achieving weight loss and reduces the risk of so many other diseases in the body. Not only does it make you, help you feel better, but your risk of certain cancers, of heart disease, of diabetes are all reduced. So I find it saddens me that your GP feels that way. Now, sometimes some clinicians might suggest, well, try with diet and lifestyle changes first before you consider medication, to see if you don't need it. But absolutely, there is a good place now for medication. It's within the NICE guidelines, which are the guidelines that clinicians and doctors use to guide them on what are safe and correct treatments to give patients. So do you have to inform them? So the choice is yours. If you're sourcing your medication in the private sector with a company like ours, the choice is yours. No one forces you to inform your GP. That being said, your GP is obviously your main caregiver. They're the ones who are going to manage any other conditions or illnesses you may have. So sometimes it is valuable for them to be aware that you are taking it. They certainly can't stop you getting the medication from a reputable provider such as ours, or from a legitimate pharmacy. So the choice is yours. I think what we discuss it with you at the point of starting. We can inform your GP directly if you should so wish, but no, you're not forced to tell your GP anything. It's your treatment. It's, as long as you understand that, if it could be important to disclose it if you potentially fell ill and you ended up in hospital. If you were talking to a doctor there about the medication you were on, it would be important to tell them, because they would need to know that. But no, you don't have to tell your GP. But again, the more people who give you care that know about it, the better. But yeah, you can, the decision is yours.